Serous effusions are abnormal accumulations of fluid in the pleural, peritoneal, or pericardial cavities. These effusions may arise from a wide range of conditions, including benign inflammatory diseases and malignant tumors, because this fluid often contains exploited cells. Cytological examination plays an important role in identifying the underlying causes. Cytologically, effusions are classified as benign or malignant. Benign effusions are commonly associated with conditions such as infections, heart failure, or liver and renal diseases. In contrast, malignant effusions result from the presence of cancer cells shed into the fluid, usually indicating advanced or metastatic disease. The detection of malignant cells has important diagnostic and prognostic implications. Early and accurate diagnosis of malignant effusions is crucial as it directly affects disease staging, treatment decisions, and patient prognosis. A positive cytological diagnosis can confirm metastatic disease and may reduce the need for invasive diagnostic procedures. Cytology, particularly the conventional smear technique, is the most commonly used method for effusion analysis. However, it has limitations, including difficulty in distinguishing malignant cells from reactive mesothelial cells, low cellularity, overlapping cells, and obscuring backgrounds. In conclusion, these limitations can lead to false, negative, or inconclusive results, highlighting the need for additional techniques, such as the cell block method, to improve diagnostic accuracy.
Now, I will explain about the cell block technique, including what it is, its principle, and why it is used in efficient cytology. First, what is the cell block technique? The cell block technique is a cytological method used to process fluid specimens. In this technique, cells obtained from serous effusion are converted into a paraffin-embedded block, which is similar to a tissue biopsy. Because of this, the cell can be examined in thin sections under a microscope. This makes it easier to study the cells in detail. Next, I will explain the principle of the cell block technique. Initially, the fluid specimen is centrifuged to concentrate the cells. After centrifugation, the cell-rich sediment is collected. This sediment is then fixed and embedded in paraffin. By doing this, the technique helps to preserve cell morphology as well as tissue architecture. This preservation is important for accurate microscopic evaluation. Now, moving on to why cell block is used in efficient cytology. The cell block technique helps in the accurate diagnosis of malignancies in serous effusions. It also overcomes the limitation of conventional smear techniques. Another advantage is that it utilizes residual fluid material effectively, which might otherwise be discarded. In addition, the cell block allows the preparation of multiple sections from the same sample, making it possible to perform spatial staining and immunohistochemistry. Furthermore, the technique is reproducible, meaning consistent results can be obtained when it is repeated. The common methods used for cell block preparation include the plasma thrombin method, agar or histogel method, and formalin fixation method.
Next, I will explain the procedure about this cell block technique. Firstly is a sample collections. The serous fluid samples is collected aseptically in an adequate volume and processed as soon as possible to minimize contaminations, cellular degradations, and autolysis. Common specimens include pleural, peritoneal, and pericardial fluids, which are frequently submitted for evaluations of malignant effusions. Second is centrifugation process. The collected sample is centrifuged at 4000 rpm for 6 minutes to concentrate the cellular elements. Following centrifugations, the supernatant is discarded and the cell-rich sediment, which is pellet, is retained as it contains the diagnostically significant cells. This step is particularly important in low cellularity effusions to improve cellular yield. And next is fixations. The retained sediment is fixed in freshly prepared Nathan alcohol formalins for approximately 45 minutes. Fixations prevents autolysis and cellular degradations while preserving nuclear and cytoplasmic morphology, enabling reliable histological and immunohistochemical evaluation. After fixation, the sample undergoes paraffin embedding. Before embedding, the cell sediment is first wrapped in crayon paper and placed into a cassette. Crayon paper is used because it is water resistant and non-absorbent, which help retain the small cell pellets and prevent loss of material during 2C processing while still allowing proper penetration of the processing reagents. The cassette is then processed and embedded in paraffin. These steps allow the cell sample to be handled similarly to a tissue biopsy and help improve the quality and stability of the sections. Next is sectioning process. The paraffin blocks is cut using a microtome at the thickness of 3 micrometers. Producing thin and uniform sections is important to ensure optimal staining and clear microscopic observations. Finally, the sections are placed onto a glass slide for further staining and examination process. Finally, staining is carried out. Hematoxylin and eosin staining is used to assess overall cellular morphology, including nuclear and cytoplasmic details, and serve as an initial step for diagnosis and malignancy screening. Immunohistochemistry (IHC) is then performed to differentiate reactive mesothelial cells from carcinoma and to assist in tumor typing, thereby increasing diagnostic accuracy. Example of IHC markers is used to include cytokeratin, calcitonin, and BER-EP4.
How cell block improve efficacy in cyto-diagnosis? First, what defines efficacy in cyto-diagnosis? Efficacy refers to the ability of a cytological technique to provide accurate and reliable diagnostic information, not just the detections of abnormal cells. This reflects a shift in perspective where cytology moves from a basic screening tool towards a definitive diagnostic method that supports clinical management. Efficacy in cyto-diagnosis is commonly evaluated through several parameters, include preservations of architecture and differentiations of reactive versus malignant cells, as well as diagnostic yield, which indicates whether the sample provides adequate and interpretable material, as well as sensitivity and specificity, which measures how accurately malignant cases are identified and non-malignant cases are excluded. Another important factor is cellularity and architecture, referring to the physical quality and structural preservations of the sample. Together, these parameters explain how techniques such as the cell block method improve efficacy in situ diagnosis, which will be discussed further in the following slides. Firstly, cell block improve diagnostic yield by concentrating cellular material from serous effusions that may be dispersed or lost in conventional smears. This will increase yield, leads to fewer repeat aspirations and an earlier diagnosis for the patient. Secondly, cell block enhances sensitivity and overall diagnostic accuracy. By increasing the ability to correctly identify malignant cases, especially in sample with low tumor burden, and maintaining a high rate of correctly excluding non-malignant cases by providing clearer morphological details. Then, cell block improves cellularity by converting scattered or scat cells into a dense, well-preserved pellet. This enhanced cellularity allows better evaluations by the pathologist to evaluate complex morphological features and support more confident interpretations. Cell block also allows evaluations of cell clusters and tissue-like patterns such as glandular or papillary formations, which are often flattened or lost in conventional smears. In addition, cell block provides better nuclear and cytoplasmic preservations, making the interpretations more comparable to histopathology. This architectural preservation significantly increases diagnostic confidence. Next, differentiations between reactive and malignant cells. Cell block improve the ability to accurately distinguish reactive mesothelial cells from malignant cells, particularly adenocarcinoma, which is a key indicator of diagnostic efficacy. Improved visualizations of nuclear atypia, cell arrangement, and features such as pericellular lacunae helps reduce false positive interpretations and improve diagnostic accuracy. Finally, contribution to the final diagnosis. Cell block plays a crucial role in ancillary testing, as it is considered the gold standard for immunohistochemistry. This allows identifications of the primary tumor sites such as lung, breast, and ovary. Clinically, this transforms cytology from a preliminary screening method into a clinically actionable diagnostic report that directly guides patient treatment. Now let's take a look at the comparisons between conventional smear and cell block. Conventional smear involve directly spreading centrifuge fluid cells onto a glass slide for microscopic examination. It is simple, rapid, and cost-effective, making it suitable for routine screening and providing an early indications of malignancies. However, conventional smears often shows low cellularity due to cell loss during preparations. Cells are usually seen in singly or in loose clusters with poor preservations of overall architecture. The background may contain blood, proteinaceous material, and debris, which can obscure cellular details. As a result, conventional smears have only moderate sensitivity for detecting malignancies and limited ability for ancillary testing. In contrast, the cell block technique processes fluid sediment into a paraffin-embedded tissue block that is sectioned and stained similarly to a histological biopsy. This technique better preserves tissue architecture, allowing visualizations of gland formation, papillary structures, and solidness, which helps confirm malignancies, especially when malignant cells resemble reactive mesothelial cells in smears. Cell block also concentrates cells into a single block, resulting in higher cellular yield and improved diagnostic accuracy. The cleaner background further enhances cell visualization. Although the technique is more complex, time-consuming, and costly, it provides higher sensitivity and specificity. It also allows special stain and immunohistochemistry for tumor typing. Overall, conventional smear is a good initial diagnostic tool, while the cell block technique increases diagnostic yield by approximately 10 to 15% when used as an adjunct. Rather than seeing it as competing methods, both techniques are complementary, with costs justified by improved diagnostic accuracy.
Why HRC improve efficacy in effusion? Conventional smears in serous effusion cytology often have limited efficacy because reactive mesothelial cells can resemble malignant epithelial cells, leading to inconclusive or false negative results. The cell block techniques allows paraffin-embedded material for immunohistochemistry (IHC), which adds marker-based evidence to morphology and increase sensitivity, accuracy, and overall diagnostic confidence. Mesothelial immunoprofile and its role in efficacy. Reactive mesothelial cells are positive for carotene and WT1 and negative for CK7 and CK20, confirming mesothelial origin. This prevents misdiagnosis of benign cells as malignant, reduces false positive, and strengthens diagnostic reliability, fulfilling the slight point that IHC differentiates mesothelial from malignant cells. Adenocarcinoma immunoprofile and its roles in efficacy. Adenocarcinoma cells are positive for CK7 and CK20. It is negative for carotene and WT1, confirming epithelial malignancy. This helps identify tumor origin, differentiates malignant from mesothelial cells, and improve detections in low cellularity or poorly differentiated samples. Overall, IHC enhanced the diagnostic efficacy of cell block cytology by increasing sensitivity, reducing false negative and false positive results, providing objective confirmation of malignancy. When combined with conventional smears, it strengthens diagnostic confidence and ensures a more accurate final diagnosis.
Clinical implication. The cell block technique plays an important role in improving the cytological evaluation of malignant serous effusion in clinical practice. Firstly, cell block increases the detection of malignant cell compared to conventional smear, especially in cases with low cellularity or unclear cytological feature. Secondly, cell block allow immunohistochemistry to be performed on effusion samples, which help in tumor typing, identifying the primary site, and supporting tumor staging and grading. Thirdly, cell block enable more accurate diagnosis using the same effusion sample, as both smear and cell block can be prepared from the same fluid. This reduces the need for repeat aspiration and improve patient comfort. Clinical recommendation. Based on this consideration, the cell block technique should be routinely combined with conventional smear to improve diagnostic accuracy. Residual effusion fluid should be utilized for cell block preparation to maximize diagnostic yield without additional sampling. Finally, cell block preparation should be incorporated into the routine diagnostic workflow of cytology laboratories, particularly in cases suspicious for malignancy, to support confident diagnosis. In conclusion, the cell block technique is highly effective compared to conventional smear in the cyto-diagnosis of malignant serous effusion. It improves detection of malignant cell, preserves cellular architecture, and provides material suitable for immunohistochemistry, and it also allowing more accurate tumor typing, staging, and grading. Using the same effusion samples, cell block increase diagnostic yield, reduce missed cases, and minimize the need for repeat fluid aspiration. Therefore, its routine incorporation into cytology practice is strongly recommended to enhance diagnostic confidence and support optimal patient management.